5 differences between physical and emotional wounds. The feelings of physical and emotional pain come from the same parts of the brain. But why do we react differently when we see a person in physical versus emotional distress? One type of wound is not more important than the other. Open your mind and think about some of the differences between physical wounds and emotional wounds. 1. Visibility. Just because you don't see the wound doesn't mean a person isn't hurting. We can see a broken bone. Someone dealing with an emotional wound may be seen as moody or as being difficult. We don't see a person's internal struggle on the outside. 2. Compassion. Being mindful that every person you meet has some emotional wounds. Put yourself in the shoes of someone dealing with an emotional wound. Maybe you feel uncomfortable, so you try to offer advice such as, shake it off. You just need to get out and socialize more. Instead, how about, I can't imagine what you're going through. Do you want to talk about it? 3. Healing time. Sorry, emotional bandages don't actually exist. You may wear a cast for 3 weeks, have physical therapy for a month, and be back to normal functioning. A lot of emotional wounds are complex, and as they're addressed, more wounds can be discovered. 4. The experience. It can be difficult to understand why. Sometimes there is no identifiable cause for an emotional wound, and the first symptoms tend to be written off because they're not physical. It can be difficult to talk about the wound, and you may not want to. 5. Long-term impact. Some scars don't fade over time. Some get darker. The long-term impact of emotional wounds can be lifelong and progressive. Many times, physical and emotional wounds run hand in hand. Physical injuries can be traumatic and may perpetuate emotional injuries and vice versa. But the hope of this article is to cause us to stop and think about emotional health and pay attention to it, to be open to it, and to understand it a little better.